You suspect in the battle against skin cancer, and it's not the sun. It could be in your genes. Researchers may have pinpointed the skin cancer gene. For more on this, we are joined by Dr. Samir Gupta, Chief Dermatologist with the Ontario Medical Association. Doctor, what can you tell us about this study?
Hi, Sarika. So this is a study that was done out of the University of Western Ontario where the researchers were trying to examine the behavior of this molecule called pannexin-1. And they wanted to compare its behavior in melanoma skin cancer cells versus normal cells. And what they found is that in melanoma skin cancer cells, the amount of pannexin-1 was significantly higher than in the normal state. So why is this important? They also were able to correlate that this higher amount of pannexin-1 in the melanoma skin cancer cells was related to the tumor being much more aggressive and its ability to spread. Conversely, when they knocked out this molecule pannexin-1 or reduced the levels, they noticed that the melanoma skin cancer cell behaved more like a normal cell. So why is this important to us? It's important because it gives us another molecule to perhaps aim at therapeutic options at, in that if we could reduce the amount of the molecule, perhaps in a form of a cream or an oral medication, this may mitigate the burden of melanoma skin cancer in terms of growth and metastasis. I will say that this study, it's a preliminary study. It was done in mouse melanoma skin cells. And what we would need to do is do further studies in human cell lines and gather more information before we can make any definitive conclusions about efficacy.
Still, are doctors and scientists pretty impressed by this or trying to understand more from this?
Absolutely. I think this is one piece of the puzzle. We're all trying to tame the beast of cancer. We know that when cancer is localized, it's usually, in most cases, treatable. However, when it spreads or metastasizes, that's when we run into problems. So this finding really helps us look at a molecule that could perhaps be helpful in decreasing the tumor growth and metastasis.
So what is the best way then, I guess, for people to understand for protection?
So protection involves two main components. It involves screening, and as physicians, we always want our patients to examine their skin on every few months, for instance. And what we're looking for is moles that are changing in size, shape, color, moles that may have some symptoms, bleeding, itching. And the other aspect of protection is prevention, and that involves the regular use of sunscreens. And we want people to use sunscreens January to December, Monday through Sunday, rain or shine. This isn't just a summer thing. This is really year-round.
Isn't it different for different kinds of skin? I mean, there's always this other side of the story too, right? That we need sun because we live in a country that doesn't have a lot of it. It's too cold. What's sort of that balance there?
Right. So the controversy about vitamin D is definitely real. We know that vitamin D is necessary for certain health outcomes, but as dermatologists and physicians, we recommend that our patients get their vitamin D not from the sun, but from either foods rich in vitamin D, such as salmon or orange juice, or supplementation. We don't want inadvertent UV exposure because we know that UV exposure in the form of sunlight or tanning beds causes skin cancer.
Okay, doctor, thanks so much for joining us.
Thank you very much, Sarika.
Dr. Samir Gupta, Chief Dermatologist with the Ontario Medical Association.